Hello, my name is Martha Polovich. This presentation is based on the recommendations published by the Pan American Health Organization and the World Health Organization. Although the original document is several years old, the guidelines are still relevant and the recommendations are consistent with those made by other organizations and agencies throughout the world. You can access the publication using the link shown here. Welcome to the presentation, Safe Handling of Hazardous Chemotherapy Drugs in Limited Resource Settings. These are the criteria for defining hazardous drugs. Any drugs that exhibit at least one of the characteristics listed here are considered hazardous to healthcare workers who are responsible for handling them. If drugs are known carcinogens, genotoxins, toxic to developing fetuses, reproductive toxins, have organ toxicities at low doses, such as healthcare workers might be exposed to, or have a structure or toxicity that's similar to drugs that are classified as hazardous, then they should be handled as hazardous by healthcare workers. The International Agency for Research on Cancer, or IARC, is an agency of the World Health Organization. IARC evaluates published evidence about chemicals for their carcinogenic effects. The decisions are based on the toxicity profiles of the agents themselves, but also on epidemiologic evidence supporting their being cancer-causing agents. They categorize carcinogens as Group 1A, which are known human carcinogens, Group 2A, which are probable human carcinogens, and Group 2B, which are possible human carcinogens based on the published evidence. There are many chemotherapy agents that have been classified as Group 1A by IARC, meaning they are known human carcinogens. You can see the list of them here, many chemotherapy agents that you may possibly be handling in your practice. The last two on the list, MOPP and ECB, are combination regimens. MOP refers to mustrogen, oncovin, procarbazine, and prednisone, and ECB is the combination of etoposide, cisplatin, and bleomycin. Individually, those drugs are not known to cause cancer. They're classified at a lower level. But when given in combination, they have been found to be known human carcinogens. These are chemotherapy agents that are listed by IARC as Group 2A and 2B. Again, many common drugs that you may administer or handle in your practice. You can see the couple of drugs here that ended up being on the 1A list in combination, cisplatin and bleomycin. The way that many anti-neoplastic drugs work is to alter DNA, thereby interfering with cell division. Some of the drugs are toxic to human genetic material. The genetic effects include chromosomal aberrations and increased micronuclei frequency. Micronuclei reflect ongoing DNA injury. The studies that I refer to here were conducted with healthcare workers, so they show that occupational exposure to hazardous drugs has the potential to cause genotoxic effects. Cancer occurs as a result of genetic changes. The studies I refer to here under cancer occurrence were also conducted in healthcare workers. These show that occupational exposure to hazardous drugs can increase the occurrence of cancer. Cancer usually is a result of multiple genetic changes over time and most often occurs later in life. For this reason, healthcare workers may not recognize the connection of hazardous drug exposure to a cancer diagnosis because of the length of time between the exposure and the diagnosis. Reproductive organs are sensitive to the damage from hazardous drugs and as are the rapidly growing tissues in an embryo or a fetus. Adverse reproductive outcomes such as infertility, spontaneous abortion, premature labor, and preterm birth have been associated with occupational hazardous drug exposure. One study also found an increase in learning disabilities among the offspring of nurses who were exposed to hazardous drugs while pregnant. These effects are the reason that many guidelines recommend that men and women not handle hazardous drugs when actively trying to conceive, and for women when pregnant or breastfeeding. Many studies have also documented acute symptoms in nurses and pharmacists, including hair loss, headaches, skin rashes, and allergic reactions. But it's also important to recognize that workers may not experience any symptoms when exposed to hazardous drugs. Feeling well does not necessarily mean there has been no exposure. Many of the health effects may occur long after an exposure. As I said before, healthcare workers may not recognize the connection between the hazardous drug exposure and a health effect. Most nurses and pharmacists recognize that exposure to hazardous drugs is bad, but many fail to recognize that they are possibly exposed doing their everyday work. Evidence in the published studies indicates that occupational exposure continues to occur. Several studies have been done that demonstrate the potential for exposure. Now, I'm not saying that exposure always happens when one is handling, so handling hazardous drugs does not equal exposure. But every handling activity represents an opportunity for exposure, and so workers need to be aware of these potential exposures so that they can take the appropriate precautions. For example, there have been many studies, 15 since 1992, that show contamination on external vial surfaces. Workers may not be aware of this and therefore won't be wearing personal protective equipment if they're handling vials that are intact and unopened. The reasons for this contamination are incomplete cleaning of the vials after they're filled by the manufacturer, or can occur as a result of breakage in storage or transport. So remember to wear gloves when handling the vials themselves. Over 100 studies since 1994 have demonstrated that there's contamination on workplace surfaces, both in the drug preparation and the drug administration areas. Again, contamination on vials and workplace surfaces represent an invisible source of exposure for healthcare workers. And again, healthcare workers may not be wearing PPE because they're unaware that the surfaces are contaminated. And finally, healthcare workers have had measurable amounts of drug found in their urine. This means that they were exposed during their work, metabolized the drugs, which then were excreted and could be found in their urine. All of these studies demonstrate that there is still potential exposure for healthcare workers, and so precautions must be followed to protect us all. So how do healthcare workers become exposed to hazardous drugs doing their work? Well, most exposure is thought to occur from skin contact during preparation and administration of hazardous drugs, from handling urine or soiled linens, or from contact with other workplace surfaces that are contaminated with hazardous drugs. In fact, the evidence suggests that contaminated work surfaces are the most common source of exposure today. Other routes of exposure include accidental injection by contaminated needles or broken vials or ampoules, accidental ingestion of contaminated food or drink, or transfer of contamination from hands to mouth, and also by inhalation of drug aerosols or vapors. Drug aerosols are generated when spiking IV tubing into an IV bag or bottle, or when squirting air out of a syringe, for example. This figure shows the basic occupational health approach to minimizing exposure to any workplace hazard. Of course, it is applicable to hazardous drug as a workplace hazard as well. It's called a hierarchy of controls. Although all interventions are important, a higher level intervention in this upside down triangle provides more protection than those below. The most effective control is to eliminate the hazard or substitute a less hazardous chemical. This, of course, is not possible when talking about drug therapy that we administer to patients. The next level of protection is using technology to protect the worker against exposure. Examples are biological safety cabinets, containment isolators, and closed system transfer devices. All of them contain hazardous drugs and their vapors, and when used correctly, provide worker protection. These devices, however, are the most costly type of hazard control. It's important to recognize, however, that all controls minimize exposure. In resource-limited settings where engineering controls are either unaffordable or unavailable, workers must focus on controls that may be lower on the hierarchy but do minimize exposure when used consistently. The next level, below engineering controls, is administrative controls. These include education, training, and providing information about hazardous drugs, such as that which is found on safety data sheets that come from drug manufacturers. Other administrative controls are policies and procedures that describe how hazardous drugs should be handled safely, and careful work practices that minimize generating aerosols and dusts. These controls minimize leaks and spills, which are sources of exposure for nurses and pharmacists. Although personal protective equipment, or PPE, is what people think of first as protection from hazardous drug exposure, it is really the last line of protection. Wearing PPE will minimize exposure to hazardous drugs that escape into the environment in the nurse's or pharmacist's workplace. All healthcare workers who are responsible for hazardous drug handling or work in parts of a hospital or clinic where hazardous drugs are present might be exposed doing their work. These basic safety measures apply to all of those workers, no matter what their responsibilities are. Education means the process of receiving systematic instruction about hazardous drugs. For those who handle hazardous drugs, that includes why they should avoid exposure, in other words, the adverse effects of exposure, how they can be exposed based on their work, and how they can prevent exposure, what precautions they should take. Training is supervised practice in how to work in a safe way. Such training should be specific to one's job activities. For example, pharmacists handle hazardous drugs, and their activities are different from those of nurses whose handling activity might be administration. Training should also include how to select the appropriate personal protective equipment that provides protection, chemical protection against hazardous drugs, how to wear personal protective equipment, when to wear personal protective equipment, and how to clean up spills if that is one's responsibility. Hazardous drug safety begins in the department where the drugs enter the hospital or the clinic. Unpacking hazardous drugs can result in worker exposure if there is breakage or damaged containers. Wear gloves when unpacking intact drug packages and inspect the shipping container first to make sure it has not been damaged. If all is well, then try to deliver the drugs to the storage area as soon as possible. If the packaging is damaged, treat this situation as a chemotherapy spill. Wear double gloves, a protective gown, eye protection, and a respirator. Get a spill kit and follow your spill cleaning procedures. Hazardous drugs should be stored appropriately. In the storage area, spill kits should be readily available because of the possibility of spills, and the workers in those areas should be trained in how to clean up a spill as well. Storage areas should have good ventilation. Many of the standards recommend that the room where hazardous drugs are stored be negative pressure. This may not be possible, but at least the temperature control must be appropriate for storing the drugs safely. Hazardous drugs should be stored on shelves, not on the floor. They should be stored in bins that will prevent breakage and spills of the containers of the hazardous drugs. Anyone who has to handle the hazardous drug vials or ampoules should wear gloves because of the potential for exposure because of the external contamination on the vials and ampoules. Hazardous drugs should be wiped down, the vials or ampoules, before use because of the contamination, potential contamination, and the storage area should be cleaned every 30 days. Bins should be cleaned regularly, and use a cleaner that you wipe on, not spray on, because it can spread the hazardous drug residue. Whenever hazardous drugs are transported from one place to another, they should be in a container that prevents leaks or spills, or at least contains them. Double bagging is one way of doing that, or using another type of sealed container that will capture spills if that should happen. It's recommended that hazardous drugs be transported manually rather than by mechanical transport, such as pneumatic tube systems if those are available in your setting. The use of transport bags prevent the person who is transporting the drugs from being exposed, and sometimes the products themselves, when they leave the preparation area and come to the administration area, have drug on the outside because of contamination during the preparation process. And so placing the drugs in a bag will protect that person who's transporting the drugs from that potential source of exposure. Anyone transporting should have access to a spill kit. And only personnel who know how to clean up a spill should be responsible for transporting hazardous drug doses. Most hazardous drug handling activities generate some kind of waste that it's contaminated with hazardous drug residue. For example, in the pharmacy, leftover vials are contaminated with hazardous drugs. Syringes used in the preparation are contaminated, and then, of course, personal protective equipment. And in the administration area, empty IV administration containers or syringes are contaminated with hazardous drugs. And so it's important to dispose of these carefully to protect other people from exposure to the residue of the hazardous drug on those items. It's also important to know what your local regulations are for how to dispose of these materials safely. You need to know also about air and water quality to ensure compliance with the safe disposal. You don't want to end up contaminating the water supply or the soil with hazardous drug residue, and so careful disposal is important. The preferred disposal method for materials that are contaminated with hazardous drugs, including used personal protective equipment, is incineration. It's also very important never to discard hazardous drug waste, even small amounts of drug, into the wastewater or those things like sinks or toilets which end up contaminating the wastewater. And also, it's not a good idea for these things to be disposed of in landfills. There's always the potential for the spread of that residue, and the residue doesn't go away. All the areas where hazardous drugs are handled, either prepared or administered, will need to be cleaned and decontaminated. That includes the surfaces in those areas and any equipment that is present to prevent the spread of hazardous drug contamination. Decontamination is defined as cleaning or deactivating of hazardous drugs. Deactivating means making the drug not toxic anymore, but there's no single agent that can deactivate all the currently available hazardous drugs. But it is important to recognize that alcohol does not deactivate any hazardous drugs. Alcohol is a disinfectant, and so it's used in areas where hazardous drugs are handled, but for disinfecting purposes to make the area clean, to remove bacteria so that those don't contaminate the drugs that are being prepared or handled. Most research shows that strong oxidizing agents such as sodium hypochlorite, we call it bleach, or peroxide-based cleaners can deactivate many hazardous drugs, and these are recommended for the cleaning of those areas and the equipment when it's possible. But it's also important to recognize that the cleaner that is used must be appropriate to the surface, and sometimes equipment can't be cleaned with bleach solutions because it's not, can damage the equipment, and it can also damage surfaces. Now, in most areas, like where there's stainless steel, bleach or peroxide-based cleaners are just fine, but other places these might not be appropriate. This is one of the recommended processes, and because hazardous drugs have been found on surfaces in the workplace, it's important to have a regular process in place to remove as much contamination as possible. Again, the cleaning solution must be selected based on the surface material that's being cleaned. So the following process works well for stainless steel surfaces, such as the inside of a biological safety cabinet or an isolator, but may have to be modified for other surfaces. The first step would be using a 2% sodium hypochlorite solution mixed with the detergent. Place that on the contaminated surfaces and then rinse it off. This should be followed by a neutralizing solution such as 1% sodium thiosulfate, which neutralizes the sodium hypochlorite and reduces the damage to the surface from that. So wipe that on and then off. Rinse that with water. And then in surfaces where sterile drug preparation happens, that process is followed by alcohol. Again, not for decontamination of hazardous drugs, but as a disinfectant so that the surface is clean and is less likely to result in bacterial contamination for sterile drug preparation. Remember that each cleaning solution must be in contact with the surface for a certain amount of time. Generally, that's usually at least 30 seconds, but some cleaners may require a different contact in order to do their job appropriately. Now, everywhere where hazardous drugs are handled should have a spill kit, and I've said that several times because it's important to be able to respond to a spill in a timely manner. But a spill kit can be purchased or it can be made in your setting by gathering these supplies. But these are the supplies that are necessary for cleaning up a hazardous drug spill. You need at least 2 pairs of disposable chemical protective gloves, a disposable protective gown or coverall, and shoe covers. Shoe covers, of course, are most important if the spill is on the floor. A face shield in case they're splashing during spill cleanup, a respirator, N95 or better, to prevent the person who's responsible for the spill cleanup from inhaling a residue from the drugs. Absorbent plastic back sheets, or some spill kits have spill pads or spill pillows that absorb the liquids. Disposable towels for wiping down the surface after the spill is cleaned up. 2 thick plastic disposal bags in order to place all the items that were used in the spill cleanup for appropriate disposal. A scoop for collecting glass fragments, and sometimes the spill occurs as a result of breakage of a vial or an IV glass container. And if you're going to be cleaning up sharps, then a puncture-resistant container. And most recommendations are also to have a sign that says caution hazardous drug spill in order to keep people away from the area of the spill while the spill is being cleaned up. It's very important to identify a hazardous drug spill as soon as possible. There's evidence to suggest that the sooner the spill is cleaned up, the more likely one is able to completely remove the spill from the surface. So your focus should be identifying the spill as soon as possible, limiting the spread of the spill, limiting the exposure of others, such as after you place the sign so people will stay away from the area during the cleanup. Then you access the spill kit, clean up the spill as soon as possible, and then you have to deal with the contaminated surfaces or items. Wherever the spill occurred, you have to select the decontamination process based on what surfaces have been soiled as a result of the spill. So every organization, hospital, or clinic should have a policy on how to clean up a spill and what cleaning solutions should be used for the decontamination process. It's possible for bed linens, if bed linens are in your area, such as an inpatient area where the patient might be receiving a hazardous drug in a bed, then linens can be contaminated. And that can be either the drugs themselves through a spill on the linens, or if the patient is incontinent, there's likely drug being excreted in the patient's urine. It's possible to be in the blood, in stool, in sweat, or in vomit as well. So these are all potential sources of contamination of linen. Workers who are responsible for cleaning up after that should wear protective gloves when handling contaminated linen. That's not to say that all linen that's used for a patient who's receiving hazardous drugs will be contaminated, but if there's known contamination on the linens, then one has to handle them as though they're contaminated materials. They should be placed in a special linen bag that will be pre-washed, and that protects the laundry workers from exposure to the hazardous drugs. And then they're placed in the regular laundry. All current guidelines for the safe handling of hazardous drugs recommend that persons who are responsible for handling hazardous drugs be followed in a medical surveillance program. The purpose of medical surveillance is to identify any health changes that might come from exposure early. We want to prevent any long-term effects from ongoing exposure to hazardous drugs. In some situations, in institutions that have limited resources, who might not have an employee health department, let's say, there are a few key elements that can be used to track employees' potential exposures over time to help minimize the long-term health effects of those individuals. These are considered the essential components of a medical surveillance program for hazardous drug handlers. The minimum would be to be able to identify those workers who are potentially exposed to hazardous drugs based on the type of work that they do, so their work assignment. So pharmacists who are responsible for compounding hazardous drugs, nurses who are responsible for administering hazardous drugs, individuals who are responsible for housekeeping in the area where hazardous drugs are present. You want to be able to identify those individuals who are at high risk for exposure so that you can follow their health. You also might suggest that all hazardous drug handlers do a periodic health appraisal questionnaire. So on an annual basis, answer questions about their health that might be affected by exposure to hazardous drugs. And there's an example of a health appraisal questionnaire in the PAHO document that I referred to at the beginning of the presentation. You also want to track the population health complaints or health events that are unique or occur in excess in the population of those who are responsible for hazardous drug handling. You also would want to perform periodic observations of drug preparation and administration practices, because if workers are not using the precautions that they should, then the chance of their being exposed is higher, and that puts them in a higher risk category, and you would want to follow their health. It's important to document any worker who is exposed to spills, if workers are involved in spill cleanup activities, and if they report accidental exposure to hazardous drugs while they're carrying out their usual work. Very important that workers are taught to report any accidental exposure. Then the results of medical surveillance should be shared with employees, of course, in aggregate and de-identified so that everyone can get ongoing feedback about any potential changes in health. If your facility, though, however, is unable to provide surveillance because you don't have the resources to do that, then part of the training should be that employees should have surveillance through their primary care providers with an annual checkup and perhaps some labs evaluating their general health. We're going to discuss a couple of issues related to the safe administration of hazardous chemotherapy drugs for nurses who are responsible for these activities. Many of the safe handling precautions are the same, no matter what the route of administration of that hazardous drug is. So these are some precautions that are appropriate when getting ready to administer hazardous drugs. First, wash your hands before handling hazardous drugs. Next, put on personal protective equipment and do this before you come in contact with the hazardous drug containers. Wear 2 pairs of chemotherapy tested gloves, and this is recommended because it provides additional protection. One doesn't expect that hazardous drugs would permeate through 2 layers of gloves. However, if the outer gloves become contaminated during the handling activities, when the worker removes the outer gloves, they're less likely to transfer that contamination from the outer glove to their skin because they have another glove protecting their hands. You should always wear a chemotherapy gown. One possible exception would be if you're administering 1 dose of an intact oral drug, then gloves should be sufficient. But for all other administrations, including injections or infusions, a chemotherapy gown is necessary to protect the healthcare workers' clothing from contamination with hazardous drugs. If there's a chance of splashing based on the type of administration that you're doing, such as instilling hazardous drugs into a urinary catheter, there's a high chance of splashing, then a face shield is necessary to protect you from exposure. Always inspect the delivery container just in case the drug leaked or there was breakage during the transport process. You don't want to be surprised when you reach into the container and contaminate yourself. Another precaution is there's a potential for aerosols being present, and if that is possible, then wear a respirator. Some examples of when aerosols may be present is if you're giving an injection and you squirt air out of the syringe, that can generate aerosols of hazardous drugs. You really shouldn't do that, but if you do, then you need to wear a respirator and then make sure that you clean up any of the contamination of the area that occurs as a result of that. Generating aerosols can also occur if you are connecting IV tubing into an IV container, such as a bag or a bottle at the bedside, and that should be done in a protected environment and wear a respirator if you're going to have to do that. Locking connections are recommended to make sure that all your IV tubing, syringes, and needles are securely attached, less likely to disconnect accidentally and result in leaks. Don't ever prime hazardous drugs into a gauze pad, into a sink, or into a trash container. That is a good way to get the drug contamination on the equipment around you and also into the water supply. Perform manipulations below eye level is essentially protecting you from splashing anything in your eyes. So if you're putting tubing into an IV, do that below eye level, and if there's any splashing, then that will protect your eyes from exposure. And of course, wear personal protective equipment when you're initiating an infusion starting an infusion of hazardous drugs. And you need the same protection at the end of that infusion. Even though the IV bottle or bag might be empty, you need to wear personal protective equipment when discontinuing the infusions. The risk of exposure is exactly the same for both of those processes. At the end of administration, particularly IV administration, you want to discard those IV administration sets and syringes intact to avoid spreading contamination when you're disconnecting the infusion from the patient. Make sure that you know which containers you're supposed to dispose of equipment and used hazardous drug administration equipment. It should not be disposed of with the regular trash because hazardous drug waste needs to be handled separately. Make sure that when you're removing personal protective equipment, you do so carefully to prevent transfer of contamination from the personal protective equipment to your hands and to your clothing. And dispose of the used personal protective equipment in the designated waste container as soon as you remove it. It's not recommended to hang up gowns and reuse them. It's very difficult to put a gown on that's potentially contaminated without transferring that contamination to your clothing. And so the safest practice is to discard it as soon as it's removed and not reuse it. Then, after the handling activity, after your inner gloves are removed and discarded, make sure to wash your hands with soap and water immediately after removing the personal protective equipment. The use of alcohol hand rub is not recommended after hazardous drug handling because, again, alcohol is a solvent and it will spread any contamination on your hands. If you use soap and water, if you did transfer contamination to your skin, it's likely to be washed down the drain with the soap and water wash. The next section is about techniques for compounding hazardous chemotherapy drugs. In many situations, this is a pharmacist's responsibility, but in some settings, nurses are also responsible for compounding hazardous chemotherapy drugs. And so we'll briefly go over some of the techniques that will prevent or at least reduce the chance of exposure. When one is preparing sterile doses of hazardous drugs, such as will be administered by injection, then this compounding process requires precautions that will maintain the drug's sterility as well as protect the worker from exposure to the drug. No drug residue as aerosol or spill is allowed out of the drug vial. One should use techniques that will prevent leakage. Ampoules should be handled very carefully to avoid either form of contamination and also to prevent cuts and scrapes resulting from the sharp edges when opening ampoules. The first step in compounding sterile hazardous drug doses is to wash your hands and then to don the personal protective equipment. You should select personal protective equipment that was designed and tested for use with hazardous drugs, meaning that they provide chemical protection. Many of you may have access to a biological safety cabinet or compounding aseptic containment isolator, in which compounding should take place. However, in situations where those engineering controls are not available and you have to do the compounding outside of an engineering control, it's essential to use full personal protective equipment. Performing these in an area that has limited traffic so that others are not exposed during that preparation process is also important. Full PPE means a coated gown, double hand HD tested gloves, eye protection because there's always the potential for leakage when withdrawing drugs from a vial, an N95 respirator and a face shield to protect against splashes. When preparing hazardous drugs, it's also important to make sure that the product which is supposed to be sterile, is not contaminated. And so wiping your gloves with an alcohol-saturated cloth frequently in between manipulations will help reduce the amount of bacterial contamination in the finished product. These are some general instructions for compounding sterile hazardous drug doses. Always wipe off the vials or ampoules with a moist wiper in case there was some hazardous drug residue on the external vials or ampoules coming from the manufacturer that way. Use syringes that when they have the drug dose that's required will be no more than 3/4 full, and this will prevent accidentally pulling out the plunger and spilling a hazardous drug as a result of that. Use needles with an appropriate gauge and length for the vial and also the final container that the drug will be injected into. And when providing the dose in a syringe, make sure that a cap is applied to that syringe so that it won't be transported with a needle, which can result in injection or at least a sharp injury to the person transporting. The needle will be applied then at the point of administration. So use a locking cap on that syringe to prevent leaks during transport. If the drug will be administered in an IV bag or bottle, then the IV tubing should be spiked into the bag or bottle before the hazardous drug is put in that delivery device. That then allows you to prime the set with a neutral or plain solution that does not have hazardous drug in it. And that makes it safer at the other end for the nurse who's going to have to attach that tubing to the patient. So prime the set with the solution from that bag or bottle before adding the hazardous drug. Then swab the injection port with a sterile alcohol wipe and allow it to dry before you enter the drug into the delivery bag or bottle. Maintaining a negative pressure when withdrawing medication from a vial reduces the chance of drug leaking during that transfer. This is always important, but especially so when not using an engineering control such as a biological safety cabinet or an isolator. When withdrawing liquid from a vial, draw up slightly less air into the syringe than the volume of the dose to be withdrawn. After the initial puncture, draw back on the plunger, creating a negative pressure in the hazardous drug vial. Invert the vial to allow the liquid to enter the syringe, and then repeat the let go and pull back on the plunger until the correct dose is transferred to the syringe. Once the dose volume has been transferred to the syringe, hold the syringe plunger firmly and place the vial upright on the work surface. Move the needle into the air space above the drug and draw back slightly on the plunger, bringing air into the syringe just to the top of the syringe hub, not into the syringe. This clears the hazardous drug liquid from the needle. Hold the plunger firmly as the vacuum in the vial will strain to equilibrate the pressure. Remove the needle from the vial septum. Then you have your dose in your syringe. And if you can transfer it then to an IV delivery system or cap the syringe if that is the method for the delivery. Ampoules are difficult to manipulate, so thankfully there aren't all that many hazardous drugs that are delivered in ampoules. Most of them are in vials, but you may have opportunity to withdraw liquid drug from an ampoule. It's an open system. There's no barrier to the sterile liquid, so you can introduce contamination. It's also an opportunity to contaminate the environment with a hazardous drug. So you want to avoid microbial contamination and also the hazardous drug escaping into the environment. Wear an N95 respirator plus a face shield for compounding in the open. In the open, I don't mean open air, I mean outside of a containment cabinet. And consider that glass fragments may be present when the ampule is cracked, and so you should use a filter needle when you are withdrawing drugs from ampules. Put a filter needle on the end of your syringe to draw that hazardous drug from an ampule. Place the ampule on a work surface. Clear the liquid from the neck of the ampule by tapping it, and then wipe the ampule neck with an alcohol swab and allow it to dry. Next, place a sterile gauze around the neck of the ampule to protect your hand as you're going to break that glass. Hold the ampule at an angle, grasp the top of the ampule, and break it off with a snapping motion away from you. Then tilt the ampule and insert your filter needle into the liquid in the ampule and pull back on the syringe plunger to withdraw the desired volume of solution. Make sure that you recap the filter needle and remove it. Hopefully it captured any glass fragments. Place a new needle on the syringe if the hazardous drug dose is to be injected into a secondary container, or replace the filter needle with the cap if the dose is to be delivered from a syringe. Contain the ampule in a sealable container and discard it in the appropriate hazardous drug waste container. The toxicity of hazardous drugs has been well known since their initial clinical use almost 70 years ago. It has often been the toxic side effects of these drugs that have limited their therapeutic value. The benefits of using hazardous chemotherapy drugs for treating cancer patients often outweighs the risk of toxicity. These drugs present the same potential toxicity to exposed healthcare workers. Nurses and pharmacists, however, have no benefit from exposure to hazardous drugs, only the risks for adverse outcomes when they are exposed. Guidelines for the safe handling of hazardous drugs have been available since the mid-1980s. Professional organizations like the Oncology Nursing Society and agencies like OSHA in the US and the Pan American Health Organization have published the guidelines based on evidence to minimize exposure of healthcare workers. It is important to recognize that the potential for exposure remains. We must be familiar with the practices that will make our work safer. Remember that our patients who need these medications need us. We must take care of ourselves in order to take better care of our patients.